Today we're talking about semaglutide, a medication millions of people take every day, often for years, but rarely fully understand. This video is designed with listening in mind and follows a clear, easy-to-follow structure. My main goal is to save you time and provide reliable, trustworthy information. I'll walk you through how semaglutide is officially intended to be used in USA, what it does in the body, what side effects matter most, and which warning signs should never be ignored. The goal is simple: to help you better understand the official instructions, so conversations with your doctor or pharmacist feel clearer and less stressful. This is educational information based on FDA labeling standards, not medical advice. Let's begin.
Block 2. Core identity and approved uses. Understanding exactly what this drug is approved for helps you verify if it aligns with your specific health needs. Semaglutide is a glucagon-like peptide-1 (GLP-1) receptor agonist used primarily for the management of type 2 diabetes and chronic weight management. In the United States, this content is specifically prepared based on FDA guidelines, where the medication is available under different brand names depending on the intended use. It is not insulin, nor is it a direct substitute for insulin, but rather a medication that helps your body regulate blood sugar levels and appetite more effectively. It is generally intended for long-term use, alongside diet and exercise modifications. The medication mimics a natural hormone in your body that responds to food intake, signaling satiety and regulating glucose.
Block 3. Brand name distinctions in the U.S. Knowing the specific brand name prescribed to you is critical because dosages and FDA-approved indications differ between them. In the U.S. market, semaglutide is sold under 3 primary trade names: Ozempic, Rybelsus, and Wegovy. Ozempic is an injectable formulation approved specifically for type 2 diabetes to improve glycemic control and reduce the risk of major cardiovascular events in adults with established cardiovascular disease. Rybelsus is the oral tablet form of semaglutide, currently approved only for type 2 diabetes. Wegovy is the injectable formulation specifically approved for chronic weight management in adults and pediatric patients age 12 and older with obesity, or adults with overweight who have weight-related medical problems. While the active molecule is the same, the dosing escalation and maximum doses vary significantly between these products.
Block 4. Mechanism of action. To understand the effects of this drug, it helps to know how it mimics your body's natural response to eating. Semaglutide functions as an analog to human GLP-1, a hormone primarily produced in the gut. When you eat, GLP-1 is naturally released to tell your pancreas to produce insulin and reduce glucagon secretion, which helps lower blood sugar. Semaglutide binds to the same receptors, but lasts much longer in the body than the natural hormone, which is degraded quickly. By activating these receptors, it slows down how fast your stomach empties and signals to the brain that you are full. This dual action on both blood sugar regulation and appetite centers in the brain drives its therapeutic effects.
Block 5. Effects on appetite and weight. This block explains why patients often experience significant changes in hunger cues while on this therapy. By acting on the hypothalamus, the part of the brain that regulates food intake, semaglutide increases feelings of fullness and satiety while decreasing hunger and cravings. This often leads to a spontaneous reduction in calorie intake without the need for obsessive counting. Clinical trials have shown that this mechanism can lead to substantial weight loss, particularly with the higher doses found in the Wegovy formulation. However, the FDA emphasizes that this medication works best when combined with a reduced calorie diet and increased physical activity, rather than as a standalone solution.
Glycemic control efficacy. For patients with diabetes, understanding how this drug lowers A1C is essential for monitoring progress. Semaglutide stimulates insulin secretion in a glucose-dependent manner, meaning it primarily works when blood sugar levels are elevated, thereby reducing the risk of hypoglycemia compared to some other diabetes drugs.
It simultaneously suppresses glucagon, a hormone that causes the liver to release stored sugar into the bloodstream. This combination effectively lowers both fasting and post-meal blood sugar levels. Consistent use has been shown to significantly reduce hemoglobin A1C levels, a key marker of long-term glucose control.
Block 7. Cardiovascular benefits. Beyond blood sugar and weight, this medication plays a significant role in protecting heart health for high-risk individuals. The FDA has approved the injectable formulation Ozempic to reduce the risk of major adverse cardiovascular events like heart attack, stroke, or cardiovascular death in adults with type 2 diabetes and established cardiovascular disease. More recently, Wegovy was also indicated to reduce cardiovascular risks in adults with cardiovascular disease and either obesity or overweight. This protective effect is thought to be independent of weight loss alone. For those interested in the broader context of metabolic health and cardiovascular risk reduction, experts like Peter Attia, MD, frequently discuss the nuances of these parameters in their educational content.
Block 8. Injectable dosing schedule. Following the correct titration schedule is the most effective way to minimize severe side effects. For the injectable forms, Ozempic and Wegovy, the medication is administered once weekly on the same day each week. The standard protocol involves starting at a low dose, typically 0.25 milligrams, for at least 4 weeks to allow the body to adapt. The dose is then gradually escalated every 4 weeks until the maintenance dose is reached. Rushing this process significantly increases the risk of severe nausea and vomiting. You do not need to take the injection at the exact same time of day, but consistency with the day of the week is important for maintaining stable drug levels in your system.
Block 9. Injection technique and sites. Proper administration ensures the medication is absorbed correctly and minimizes discomfort. Semaglutide injections are subcutaneous, meaning they go under the skin, not into a muscle or vein. The recommended injection sites are the front of the thighs, the abdomen, keeping 2 inches away from the belly button, or the outer upper arm. You should rotate the injection site each week to preventing skin hardening or irritation. The injection pens are pre-filled and designed for patient use, typically involving attaching a fresh needle, dialing the dose, inserting the needle, and holding the button down for a set count to ensure the full dose is delivered. Never share a pen with another person, even if the needle is changed.
Block 10. Oral tablet administration. If you are taking the tablet form, adhering to strict intake rules is non-negotiable for the drug to work. Ribelsis has very low oral bioavailability, meaning it is difficult for the body to absorb. To ensure absorption, you must take the tablet on an empty stomach immediately upon waking up. It should be taken with a sip of plain water, no more than 4 ounces. You must wait at least 30 minutes before eating, drinking anything else, or taking other oral medications. Failure to follow these specific steps can result in the medication passing through your system without being absorbed, rendering the treatment ineffective.
Block 11. Handling missed doses. Knowing what to do if you forget a dose prevents accidental doubling up or lapses in treatment coverage. For the weekly injection, if you miss a dose, take it as soon as possible within 5 days of the missed dose. If more than 5 days have passed, skip the missed dose and resume your regular schedule on the next scheduled day. Do not take 2 doses within 3 days of each other. For the daily oral tablet, if you miss a dose, skip it entirely for that day and take your regular dose the next morning. Never double the dose to make up for a missed tablet.
Block 12. Common gastrointestinal effects. The most frequent complaints with this medication involve the digestive system, and expecting them can help you manage anxiety. Nausea, vomiting, diarrhea, stomach pain, and constipation are very common, especially when starting therapy or increasing the dose. These side effects are largely due to the delayed gastric emptying caused by the drug. For most patients, these symptoms are mild to moderate and tend to decrease over time as the body adjusts. However, for some, they can be persistent. Reporting the severity of these symptoms to your provider is important, as they may adjust your titration schedule to help you tolerate the medication better.
Block 13. Managing nausea practically. Small adjustments to your eating habits can significantly reduce the nausea associated with semaglutide. To mitigate nausea, try eating smaller, more frequent meals rather than 3 large ones. Avoid high-fat, fried, or very spicy foods, as these are harder to digest and can worsen symptoms. Stop eating the moment you feel full. Overeating while on GLP-1 agonists often triggers vomiting. Staying hydrated is crucial, especially if you experience vomiting or diarrhea. If you are looking for broader strategies on managing lifestyle and diet changes during metabolic treatments, channels like Dr. Eric Berg, DC, often cover practical dietary approaches that may be complementary.
Block 14. Hypoglycemia awareness. While low blood sugar is less common with semaglutide alone, the risk changes depending on what other medications you take. Semaglutide by itself rarely causes hypoglycemia, dangerously low blood sugar. However, if you use it in combination with insulin or sulfonylureas like glipizide or glimepiride, the risk of hypoglycemia increases significantly. In these cases, your doctor may need to lower the dose of your insulin or sulfonylurea to prevent blood sugar crashes. You should be familiar with the signs of low blood sugar, such as dizziness, confusion, shakiness, and sweating, and keep a source of fast-acting glucose, like juice or glucose tablets, available just in case.
Block 15. Acute pancreatitis risk. Serious inflammation of the pancreas is a rare but critical risk associated with this class of medications. Clinical trials have observed cases of acute pancreatitis in patients taking GLP-1 agonists. You should be aware of the hallmark symptom: persistent, severe abdominal pain that may radiate to the back, often accompanied by vomiting. If you experience this specific type of pain, you must discontinue semaglutide immediately and seek urgent medical evaluation. Patients with a history of pancreatitis should discuss this risk thoroughly with their provider, as this medication may not be suitable for them.
Block 16. Gallbladder complications. Rapid weight loss and the medication's mechanism can stress the gallbladder, leading to stones or inflammation. Semaglutide usage has been associated with an increased risk of cholelithiasis, gallstones, and cholecystitis, gallbladder inflammation. Symptoms include pain in the upper right side of the stomach, fever, yellowing of the skin or eyes, jaundice, or clay-colored stools. Because significant weight loss itself is a risk factor for gallstones, it can be difficult to distinguish the cause, but the management remains the same. Surgical intervention to remove the gallbladder may be required in severe cases.
Block 17. Thyroid C-cell warning. This specific safety warning appears in the most prominent section of the FDA labeling for good reason. In rodent studies, semaglutide caused thyroid C-cell tumors, including medullary thyroid carcinoma, MTC. It is unknown if this risk translates to humans, but as a precaution, the FDA has placed a boxed warning on the drug. Semaglutide is contraindicated for patients with a personal or family history of medullary thyroid carcinoma, or patients with multiple endocrine neoplasia syndrome type 2, MEN2. You should monitor for symptoms such as a lump in the neck, trouble swallowing, or persistent
Block
hoarseness.
18. Diabetic retinopathy complications. For patients with a history of eye issues related to diabetes, rapid glucose improvement requires careful monitoring. A temporary worsening of diabetic retinopathy has been observed in some patients treated with semaglutide, particularly those with a history of the condition who experience rapid improvement in blood sugar control. While long-term control is beneficial for eye health, the sudden shift can destabilize blood vessels in the retina. Patients with a history of diabetic retinopathy should have regular eye exams and report any changes in vision to their healthcare provider immediately.
Block 19.
Kidney function and dehydration. Protecting your kidneys is largely a matter of managing the gastrointestinal side effects effectively. There have been reports of acute kidney injury and worsening of chronic renal failure in patients taking semaglutide. This is usually caused by dehydration resulting from severe nausea, vomiting, or diarrhea. It is vital to maintain adequate fluid intake. If you have existing kidney problems, your doctor may monitor your renal function more closely, especially during the dose escalation phase when side effects are most likely to occur.
Block 20. Anesthesia and aspiration risk. Recent guidelines highlight a specific risk for patients undergoing surgery requiring sedation. Because semaglutide delays gastric emptying, there is a risk that food remains in the stomach even after standard fasting periods, which can lead to pulmonary aspiration, inhaling stomach contents during anesthesia. Current medical consensus suggests holding, not taking, the medication for a specific period, typically 1 week for weekly injections, before elective surgeries. Always inform your anesthesiologist and surgical team that you are taking a GLP-1 agonist so they can take appropriate safety precautions. Block 21. Drug interactions regarding absorption. The way this drug slows your stomach can impact how your body absorbs other oral medications. Semaglutide causes a delay in gastric emptying, which may impact the absorption rate of concomitantly administered oral medications. This is generally not clinically significant for most drugs, but caution is advised for medications with a narrow therapeutic index or those that require rapid onset. Always provide your doctor and pharmacist with a complete list of all supplements and medications you take so they can screen for potential timing conflicts.
Block 22. Pregnancy and lactation. Planning ahead for reproductive health is essential because this medication remains in the body for a long time. Semaglutide should not be used during pregnancy due to potential risks to the fetus observed in animal studies. The recommendation is to discontinue the medication at least 2 months before a planned pregnancy to ensure it has fully cleared from your system. It is also not recommended while breastfeeding, as data on the transfer of the drug into human milk is limited. If you become pregnant while taking semaglutide, contact your healthcare provider immediately to discuss alternative management strategies.
Block 23. Pediatric and geriatric considerations. Usage rules differ significantly based on the age of the patient. Wegovy, for weight loss, is approved for adolescents aged 12 and older with obesity, but dosing must be carefully managed. Ozempic and Rybelsus are not currently approved for pediatric use. For geriatric patients, adults over 65, no specific dosage adjustment is required based on age alone, but greater sensitivity to side effects is possible. Older adults are also more prone to dehydration, making the management of gastrointestinal side effects even more critical to prevent complications like dizziness or falls.
Block 24. Mental health monitoring. While rare, monitoring for changes in mood is a standard safety precaution for weight management medications. The FDA labeling for weight management formulations includes a warning to monitor for suicidal behavior and ideation. While a clear causal link has not been definitively established in broad data, patients should pay attention to any sudden changes in mood, behavior, thoughts, or feelings. If you or a caregiver notice new or worsening depression or suicidal thoughts, discontinue the medication and seek immediate support.
Block 25. Storage and handling protocols. Proper storage ensures the protein in the medication does not denature and become ineffective. Prior to the first use, semaglutide pens must be stored in the refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius. Do not freeze them. If they freeze, they must be discarded. After the first use, the pen can be stored at room temperature, up to 86 degrees Fahrenheit or 30 degrees Celsius, or in the refrigerator for up to 56 days. Always keep the pen cap on when not in use to protect the medication from light. Rybelsus tablets should be kept in their original blister pack until immediately before use to protect them from moisture.
Block 26. Cost and insurance in the U.S. Navigating the financial aspect of this therapy is often as complex as the medical side. In the United States, insurance coverage varies wildly depending on the diagnosis. Many plans cover Ozempic for type 2 diabetes, but may deny Wegovy for weight loss, even for the same patient. High deductibles and copays are common. Manufacturers often provide savings cards for commercially insured patients, but these cannot be used by patients with government insurance, like Medicare or Medicaid. Verify your formulary coverage specifically for the brand name prescribed before initiating therapy.
Block 27. Compounded Semaglutide Warnings. This block addresses a specific and urgent safety alert from the FDA regarding non-branded versions of the drug. Due to shortages, some compounding pharmacies in the USA have been creating compounded versions of semaglutide. The FDA has issued warnings that some of these compounded products use salt forms, semaglutide sodium or semaglutide acetate, which are different from the active ingredient in the approved drugs. These salt forms have not been shown to be safe or effective. The FDA advises patients to obtain semaglutide only via a prescription for the FDA-approved products, Ozempic, Wegovy, Rybelsus, dispensed by a licensed pharmacy to ensure safety and sterility.
Block 28. Summary Monitoring Checklist. Keeping a routine checklist helps you stay proactive rather than reactive regarding your health. When taking semaglutide, your monitoring routine should include regular A1C checks, if diabetic, periodic weight checks, and observation for any persistent gastrointestinal issues. Be vigilant for signs of dehydration, gallbladder pain, or vision changes. Ensure you are attending follow-up appointments to reassess dosage and necessity. Discuss any planned surgeries or pregnancies well in advance. This proactive approach allows you to gain the benefits of the medication while mitigating the most serious risks. Block 29. Final Conclusion and Disclaimer. You now have a clearer understanding of how semaglutide functions, the specific FDA protocols for its use in the USA, and the safety signals that require attention. Whether strictly for diabetes or for weight management, the medication is a powerful tool that requires respect for its dosing schedule and potential interactions. Always maintain open lines of communication with your prescribing physician or pharmacist regarding any new symptoms. This video was not created by a professional doctor, and nothing said here is medical advice. Please take care of your health. I wish you luck and freedom.